This job, it definitely is different in a lot of ways than other work that I've done. I'm not seeing people on a great day. I'm usually seeing people on one of the worst days for them, and that can be tough. But I do feel like, especially having the backing of a really supportive team, that person first approach is really important and helps me to remember that, like, this is a really amazing opportunity that I have to help them work through something really difficult, or to even just be there to try and guide them along a really twisty path when it comes to what happens next.
And your entry point into this work, you worked for the Underground Railroad at one point in time in Saginaw, correct?
Yes.
What did that look like for you?
Yeah, so that it was definitely a different type of job than what I do now, just because it was a lot more, I was a fly on the wall in a lot of ways. It's an incredibly important job doing the supervised visitations, but it was definitely more hands-off in a lot of different aspects of it. It was a lot of making sure to facilitate a situation that was really safe, where kids weren't being used, or I don't know how to describe it, but basically where kids were safe and could have a relationship with, potentially an offending parent. But I didn't get to directly impact a lot of those situations, and I wanted to move to a type of work where I could come in a little bit earlier, which was what appealed to me about the prevention work. And then when it comes to the work that I do now in the day-to-day, I get to be in that investigative, collaboration. So I feel that I get a little bit more hands-on.
I think it's really important for people to understand the type of services that really uphold a community and play integral roles in the health of some of our youngest residents. So when you look at the Child Advocacy Center, give me your boilerplate pitch. What is it that you guys do?
Yeah, absolutely. So Child Advocacy Centers do a lot of different things. We are the only child advocacy center in Midland County. We cover the whole county. And we have two, we sometimes refer to them as like pillars of what we do. We have our prevention work and we have our intervention work. Prevention is really focused on education, like I mentioned earlier, in classrooms, going into classrooms, talking to kids about body safety, about consent, all of that, making sure that they really have the tools that they need to keep themselves safe and to speak up if ever they're not comfortable with something. Making sure that parents and caregivers and adults who work with children or around children have the resources and tools they need to facilitate tough conversations, recognize when a child might need help, or learn how to react appropriately if something's disclosed to them. And then we have the intervention side of things where I work. And that's where if there is suspected child abuse or neglect, when a report's made to like law enforcement or CPS, we act as kind of a hub for those investigating parties. And they send in a referral. We host the interview at our center where it's really trauma-centered, or trauma-informed, child-centered. And try to just conduct that in a way that really focuses on making the child and family the center of their investigation, lowers the amount of times the child has to discuss something really traumatic. It just really acts as a hub for those things so that it's not as all over the place as it used to be, as uncoordinated as it used to be before CAC model was kind of the norm.
In a CAC model, you hear this is nationwide, correct?
Yes.
But it's not one overarching organization. It's more of a code name for the organizations in general, or how do the CACs function as an umbrella piece?
Yeah, absolutely. So we have like an accrediting body. So we have standards that we have to fall within to be accredited by the National Children's Alliance. And they really accredit and cover all of the CACs in the nation. And then we have some more regional umbrella organizations, if that makes sense. We have CACMI for Michigan. We have some regional divisions within both the country and the state, just to kind of support each other. But as far as that overarching accrediting body, NCA really sets the standard that we have to operate by, and that allows for all of our child advocacy centers across the nation to really make sure that we're doing things in a way that is consistent and just provides the same level of care, I guess, if that makes sense.
Subscribe wherever you consume media. Max Loves Midland is your entertainment, resources, and collective improvement hub for Midland County. Plan your next adventure in Midland at maxlovesmidland.com.